So these last few years have been a very exciting time for patients with acute myeloid leukemia, in that we've seen a number of new therapies which have now been licensed both by the FDA in the US and also by the EMA in Europe. And these new treatments are improving outcomes, and one of the areas that we're focusing on in the discussions over the next couple of days is very much about how these new therapies perhaps can reduce the need for allogeneic transplant. Historically, it's been absolutely clear that transplant is the most effective way at preventing relapse in acute myeloid leukemia, but it carries with it significant risk and significant toxicity. So some of these new treatments lack that toxicity, and we're seeing survival rates improved such that patients may not need transplantation. The diagnostics have improved, so we're being able to identify these groups of patients, and further studies which would be outlined as a part of the conference here will help us in identifying those subgroups and improving the outcome further for patients with acute myeloid leukemia.